You know, a C-section is one of the most common surgeries in the entire world. And get this, for many of them, the mother is awake for the whole thing. But what's actually going on in there? What does the surgeon see, layer by fascinating layer? Well, today we're going to take a journey, an anatomical journey, to see exactly how a new life is brought into the world.
So, just how common are we talking? Well, C-sections make up somewhere between 20 and 30% of all births on the planet, and that number is actually rising. So let's be clear, this isn't some rare last-ditch procedure. It's a major abdominal surgery, for sure, but it's also a routine and life-saving part of modern medicine for millions of families every single year.
All right, here's our game plan for this journey. We'll start by setting the stage for surgery. Then, we'll move layer by layer through the abdominal wall. We'll see how surgeons pull off a clever trick to navigate the core muscles, reach the uterus, and, of course, witness the delivery itself. And finally, we'll see how it all gets carefully put back together.
Now, of course, no two C-sections are ever exactly the same, but the modern techniques have a whole lot in common. So we're going to explore the typical path a surgeon takes, and let me tell you, it's a real testament to some incredible surgical skill and a deep, deep knowledge of anatomy.
Okay, so this is where it gets really interesting, because the situation itself dictates the very first cut. For a planned C-section, surgeons almost always go for a low, horizontal bikini line cut. Why? Because it heals really well and it follows the body's natural lines. But in an emergency, every single second counts. A vertical incision right down the midline gives the absolute fastest access to the baby. We're talking about a choice that can literally be the difference between life and death. So let's zoom in on that first cut. In a planned surgery, the surgeon makes a really precise incision just a couple of centimeters above the pubic symphysis. That's the firm piece of cartilage connecting your pubic bones right at the front. And that spot is chosen for a reason. It helps avoid crucial things like the bladder. Meanwhile, the mother is awake, numbed by anesthesia, feeling some pressure, but absolutely no pain. The scalpel then moves through the first three layers. You've got the epidermis and the dermis, that's our skin, and right below that is the hypodermis, which is basically a layer of subcutaneous fat. And, you know, the thickness of this fat layer can be wildly different from person to person. Now, this is absolutely key. The surgeon deliberately, very carefully, stops the sharp incision before they get to the abdominal muscle. The last thing they want to do is cut horizontally right across the six-pack muscles. You see, cutting muscle fibers means a lot more bleeding, a much longer recovery, and a way bigger risk of problems down the road.
So this brings us to a huge challenge, and frankly, a really brilliant surgical solution. How in the world do you get past these powerful core muscles without actually cutting through them? Well, this is where a real respect for the body's design just shines through.
So, just below that fat layer, the surgeon finds this, the rectus sheath. It's this incredibly tough, white, fibrous covering that basically wraps around those ab muscles. You can think of it like a strong, natural corset that holds your whole core together.
And right here, this shows us the surgeon's next target. Running straight down the middle of the abdomen, the sheaths from the left and right sides fuse together. This forms the linea alba, which literally means the white line in Latin. And here's the critical part. It's connective tissue, not muscle. It's the perfect surgical pathway.
So let's put it all together. It's an ingenious detour. First, the horizontal skin cut. Then, the surgeon completely switches directions, making a small vertical cut right along that linea alba. This lets them gently part the two halves of the rectus abdominis muscle, just separating them down the middle without cutting a single muscle fiber. It's an incredibly elegant technique that saves the muscle and makes healing so much better.
And just like that, with the muscle safely parted to either side, the surgeon is now looking right into the abdominal cavity. The final destination is finally in sight.
After making one last tiny cut through a thin, almost glistening membrane called the peritoneum, they're in. The main abdominal space is open, but it probably doesn't look like what you'd see in an anatomy textbook.
It's amazing, actually. At full-term pregnancy, the body has already done most of the prep work. The uterus has grown so large that it's physically pushed the intestines and other organs up and out of the way. For the most part, they've just slipped behind the uterus, giving the surgeon a nice, clear path to get to work.
And now, we've arrived at the climax of the whole procedure. After all those minutes of careful dissection, layer by layer, it is finally time to deliver the baby.
What's just incredible is how fast this part happens. The surgeon makes an incision into the uterus itself, and often, within a single minute, the baby's head is gently guided out. Moments later, the baby is born. The mother gets to hear that very first cry. The entire delivery, from the first cut into the uterus to removing the placenta, can take just 5 minutes.
Okay, with the babies safely delivered, you might think we're done, but the surgery is only about halfway over. In fact, closing everything back up can often take longer than the delivery itself. So now, this meticulous process of closing everything, layer by layer, begins. The closure is pretty much the opening process, just in reverse. First, the incision in the uterus is carefully stitched up with dissolvable sutures. Then, the surgeon brings those parted ab muscles back together and sutures that all-important linea alba. And finally, the fat layer and the skin are closed up. And I really have to stress this point. Repairing that linea alba correctly is absolutely vital. This single step is what restores the entire structural integrity of the abdominal wall. Getting this part right is what prevents painful and complicated hernias later on, and allows the body to make a strong recovery. So when you think about it, from a horizontal cut on the skin to a vertical separation of the muscles, the C-section is just this elegant solution to a really complex problem. It's a procedure that perfectly marries surgical ingenuity with a deep respect for the body's own anatomy, turning a potentially dangerous situation into a safe, successful birth. It's a powerful reminder of the incredible things modern medicine can do.